Hello, my name is Justin Robinson and I also go by the name of Chef J. Rob. I'm here to introduce to you a culinary breakthrough in the healthcare industry. Hearty home meals will be the meals that heal. And I say this because patients are constantly diagnosed with chronic heart diseases such as diabetes, hypertension, obesity, and the list goes on. And their dietary intake play a key factor in help alleviating these conditions because drugs solely cannot be the cure. Now, typical geriatrics who go to the hospital, for instance, and have a post-surgery, and their doctors or dietitians actually, consult them on the different health changes that they need to have, as well as new dietary restrictions to help lead to a speedy recovery. But they're so stuck on their traditional lifestyle that they're not, used to actually changing these habits, which means that they will continue to cut the fattening foods that will raise their cholesterol levels, or they will continue to intake certain meats that aren't lean and choice cut that will actually prevent their LDL levels to clean their arteries, which will actually rise their HDL levels that will harden the arteries and prevent blockage, which will lead to another stroke and for them to be re-hospitalized. Now, hearty home meals will help alleviate this all because this will be meals that will heal delivered to your doorstep. Fresh produce, physician prescribed, nutritionist approved, and dietitian recommended, all covered by their patient's health insurance. Now, these will be the medical foods because there's only one type of medical food that is actually covered fully by insurance, and those are the foods that are actually fed through a feeding tube when patients are in the NICU or ICU or critical care units. And healthy foods are key to a person's health because green leafy vegetables, healthy fruit, and lean cut meats will be the revolution in a person's life. Now, the bond between hearty home meals and the physician will be unique like no other. And I say this because it will put money in the physician's pocket while they have the satisfaction of knowing that their patient is leading a healthier lifestyle. These will be pre-cut meats, freshly measured vegetables, and fresh picked fruit delivered at the patient's doorstep where they will have control of everything in the kitchen. Just like a traditional lifestyle that they live, but with the pre-measured ingredients for the certain condition that they may have, whether it may be diabetes, hypertension, or any chronic heart disease. They will take the produce out of the box with the pre-measured ingredients and a nice recipe list and cooking instructions so that they can prepare it in their own kitchen on their own stovetop. And this is where the psychological comfort of the patient comes to play because they know that the health of their life is in control of their hands, and both beneficiaries, the patient and the physician are both happy. Now, I want to touch a little bit more on these levels that actually cause these chronic heart disease, which is high cholesterol, triglyceride levels, LDL and HDL, which play into the total cholesterol, as well as the glucose levels. Now, many geriatrics are aware of their levels of cholesterol, triglyceride, and glucose levels. However, they're not quite sure how to moderate them and keep them at the levels that their physician typically suggests. This is where we come together as a family. The physician, the dietitian, and the nutritionist, as well as the Hearty Home family, will all put together a patient-specific meal service plan that will be delivered at the doorstep for the patient to take into their own hands. These will help moderate the levels by pre-measured ingredients, pre-cut produce, portion control, and a easy-to-follow instruction cooking list that they can follow in their home. Hearty Home meals, as stated before, will be the meals that heal and a revolutionary culinary breakthrough in the healthcare industry because it will be the first medical food service provided by a company that will deliver to a doorstep fully covered by the insurance, which means that a small copay will be less the cost of a full meal itself, which is great in terms for the patient because they're saving money and they're bettering their health at the same time because it's covered by their insurance. And the foods that are great to intake, such as skinless meat, lean choice cut meats, fresh cut vegetables, high in nutrients, and freshly washed vegetables hand-picked from the garden themselves will be all included in the package, catered patient-specific to their condition. Now, a little bit more about myself. I have an undergraduate degree in biomedical science from Auburn University. I'm currently pursuing my master's in public health at Mercer University. I have a passion for cooking and nutrition itself. It all started out at Auburn University, where I was cooking out of my dorm, and now I've kind of had a little bit more of a mature progression in the culinary industry. I'm currently, both of my grandmothers have been diagnosed with diabetes type 2, and I've also noticed that sometimes they can't afford the certain foods to lead a better lifestyle. So I wanted to figure out how I can impact them, as well as other patients in geriatrics that have similar conditions to them or even worse. So I've came up with hearty home meals, and I've done my research to ensure that these can be covered by their insurance, that can be made cost affordable and better their lifestyle and live longer, healthier lifestyles that will actually help bring in a family and alleviate the worries that they may have on their actual family members. A little bit more about myself in the culinary industry. I've participated in the Food Network's Iron Chef. I've also actually been the first chef to appear on WTVM News 9, and I prepared a salmon tortellini with a low-fat Alfredo sauce and my own fruit flatbread. And I had both of my grandparents try it. It's not traditional, as we talked about. A lot of geriatrics are used to their traditional foods, but they see things that they like. They know they like bread, they know they like fruit, and they eat salad from time to time. So I combined it all together and let them try it. And to their surprise, just like if it followed in the instructions provided in hearty home meals, they'll actually enjoy it and they'll turn out to lead a better life. And it'll actually open their palate and open up their heart, if you know what I mean. So I hope that you understand, and if you have any questions, please feel free to contact me. I hope that these will be a revolutionary breakthrough in the healthcare industry, and just remember, hearty home meals will be the meal that heals. Thank you for your time.